The CDC is updating quarantine guidelines for COVID-19. During today's briefing, South Dakota's Health Department discussed how that's going to impact you. KELOLAND's Lauren Solik explains.
Throughout the pandemic, the CDC has recommended 14-day quarantines for anyone exposed to COVID-19. Now they are making adjustments.
Starting tomorrow, what you will see is that this modifications to our quarantine do mean that individuals may be released as early as 7 days into what was a 14-day quarantine period.
The updated alternatives are based off of whether you have symptoms and if you've been tested. In order to end quarantine after 7 days, a person must be asymptomatic and have a negative test result.
We do ask that those individuals continue to monitor their symptoms for the duration of what would have been that 14-day quarantine period. And that's just to make sure that if they do develop symptoms, that they then will go home and that they will seek testing to assess whether they may be infected with COVID-19.
However, if a person has remained asymptomatic but does not have a test result, they can end their quarantine after 10 days.
This is going to be more or less the standard now for within the state of South Dakota.
Those people are also asked to continue monitoring their symptoms for the remainder of the 14 days. In Sioux Falls, Lauren Solik, KELOLAND News.
U.S. health officials also, again, are urging people to stay home for the upcoming winter holidays to stay safe and protect others. However, if you do travel, the CDC strongly suggests that you get a COVID-19 test before and after your trip.